all kinds of movement. They remain almost invisible.
You can't fucking stop God.
I have rarely seen a document in politics as completely devastating as the analysis the Congressional Budget Office just released of the Republican healthcare bill. We're going to get into details in a minute, but here's a one-sentence summary. Under the GOP bill, the more help you need, the less you get. It would make more people uninsured than live in New York State. And those raw numbers, those headline numbers, they actually obscure how cruel the underlying policy is. It is particularly bad for the old and the sick and the poor. It is particularly good for the rich and the young and the healthy. And understand why. You have to go into the specifics of what the bill does. So here's how it works. The bill guts Medicaid. It cuts the value of Obamacare's insurance subsidies in half. And it lets insurance companies charge older Americans 500% more than they charge younger Americans. Then it takes the subsidies that are left and it reworks them to be worth less to the poor and less to the old. It takes the insurers that are left in the market and it gives them the ability to change their plans so their plans cover fewer medical expenses for the sick. And then finally, it rewrites the tax code to offer hundreds of billions of dollars in tax cuts to the rich. And as my colleague Dylan Matthews wrote, it is an act of incredible class warfare by the rich against the poor. Imagine the set of questions you would have had to ask to get to a bill like this. Who was sitting back and saying, what American healthcare needs is more uninsured people, coverage that does not cover as much, coverage that has higher deductibles, more power for insurers to charge old people more money than young people, and finally, hundreds of billions of dollars in tax cuts for the rich. Is that the populism Donald Trump ran on? Is that what any Republican has seen in polls, even of their own voters? Because I have looked at those polls, and even Republican voters, they actually want better health care that is more affordable to them, and that actually does cover them when they get sick. The result of all this isn't just 24 million fewer people with insurance. Of the people left with insurance, the pool is tilted towards younger, healthier people who needed help less, because many of the older, poorer, sicker people who needed help the most have been driven out of the market. They don't have insurance they can actually afford. Example that keeps getting me, a 64-year-old making $26,500, somebody who very well might have voted for Donald Trump, would see his premiums rise by 750%. And now that 64-year-old gone, no insurance, but because he's gone, the pool's a little bit younger, and so premiums for the young people left are a little bit cheaper. That is the context that is required to read Speaker Paul Ryan's response to the report. He tweeted, and this was the most amazing part of the whole thing to me. He tweeted, CBO report confirms it. American Health Care Act will lower premiums and improve access to quality, affordable care. Let's break that down. So according to the Congressional Budget Office, those lower premiums Ryan is celebrating, and those premiums, to be sure, they're only 10% lower after 10 years, and that's after they rise initially. Those lower premiums, the reason you get them, his bill drove older people out of the market, it let insurers offer plans that covered fewer medical expenses, and required more out-of-pocket spending. That is not lower premiums as most Americans understand the term. Getting lower premiums by cutting out the people who needed help the most, that's not what healthcare is supposed to do. We have health insurance because people get sick, because they need it. But it's Ryan's last 5 words that demand the most attention. He says his bill will improve access to quality, affordable care. I am trying to find a way to read that statement generously. Ryan is not arguing with the CBO score here. This is what I can't believe. He is not saying the CBO is wrong and more people will be covered under his bill. He is saying the CBO is right. Its analysis proves his bill will improve access to quality, affordable care. He is saying that a bill that throws 24 million people off insurance is a bill that improves access to quality, affordable care. Look, I am schooled in healthcare policy wonk rhetoric. I know what is being said here. I know that improves access is some kind of dodge, because you can have access to affordable health insurance even if you choose not to buy it. But a bill that makes health insurance too expensive for millions to afford doesn't improve access under any definition of the word. A bill that makes the insurance not worth buying, it doesn't improve access, it doesn't improve choice. And look, maybe I'm overthinking this. Maybe Ryan did not know what his bill would do, and he's now stuck defending it because it's his bill and he sees no other choice. Maybe he's become the "this is fine" dog, cheerfully explaining away the fire raging around him, a fire he himself has set. But this is not fine. It is not decent, it is not compassionate, and is not what Republicans promised. It is a betrayal of Donald Trump's vow to protect Medicaid from cuts. It's a betrayal of Donald Trump's vow to pass a healthcare bill that covers everyone with insurance that has lower deductibles and better coverage. It is a betrayal of Paul Ryan's promise to give Americans more choices, because it is only when you can actually afford insurance that you really have the choice of which plan to buy. And it is a betrayal of the older rural voters who put Republicans in power and who will pay the most for health insurance under this proposal. It is hard to imagine the electoral reckoning that would follow the implementation of this law. But that's the thing about setting a fire. You're often the one who gets burned.